Okay, so let's go for someone who gets a bit of the winter blues would be a good idea. So anybody feel worse when the winter comes? Yeah? Do you want to come up here? You will need to expose your tummy. Is that all right? You're prepared for it? Okay, so what we talked about this morning were the fact, if you put yourself down your back, was the fact that radiation is not as random as they thought. It has cycles when it's more active and less active, okay? And that the human body expresses radiation, gamma radiation above the background radiation, that we have a big boost on at birth, and that we have cycles of the radiation during a 24-hour period, and that we know when we no longer have this as we age, we get less and less radiation output, and that most of that output comes from the minerals in the body, which have radioactive nucleotides, and they don't all emit or decay at the same time, but they have these cycles, and gradually as we age and we lose bone density, so our generation goes down. Okay. Now, one of those is more important. Well, they're all important. But the thing that you've learned, and Alma was very interesting, because would you mind just telling them, just briefly, I know, do we have a handheld mic? No, okay. Alma will tell you later, okay, about what you said about the midwife in America. Shall I tell it?
Yeah.
Yes, okay, you tell me and I'll tell them, okay. That you have a friend?
No, it's just a well-known midwife.
This is a well-known midwife in Ireland.
And she has been... thank you.
Okay, speak.
A well-known midwife in Ireland, very popular, seemingly with her clients, has just lost her position with the HSE, the equivalent of your NHS, because she insists on not cutting the umbilical cord until 10 minutes has passed. And the medical profession don't agree with that, so she has lost her job. So there's a big thing on Facebook to support her, to keep her in her position, because she's doing great work, obviously, as we now know.
And I think she'll be proved right. You know, as most people are who are dissidents, aren't they? Heretics. One of my daughters was telling me the same thing up. She lives in Leeds and does cranial work, and she knows a midwife very well who's gone through the same problem. So the midwife has gone independent now and works freelance rather than through their for the same reasons. Yeah.
Do you get a Facebook link or anything?
Have I got a Facebook link?
Facebook for that woman.
You talk to Elmer afterwards. Right. Okay, so the important thing that you've learned is the umbilicus has significance to that first breath. Okay, then you cut the umbilicus. In Chinese medicine, the umbilicus is called the shrine of God because chi, or life energy, continues to go in through that energy, through that area, through the umbilicus. Not just biochemical energy anymore, in other words, oxygen and nutrients from the mother, but it's the life energy itself. So it's a very, very important place. Now, what we will find is that if we can use that energy, or chi as it's called in Chinese medicine, or we might call it quantum energy, in other words it's a wave as opposed to a particle, and reference that around the 24-hour clock, we may find out where the issues are with a person. Right? So simply what we're going to do here is we're going to use the umbilicus as a reference. So you'll see this on your chart on the laminate here, and it's also in your manuals there. So it's quite easy. So what we're going to do is I'll start off here. Bend your knee up. That's it. Okay, and what you've got to do is pull your knee to your shoulder. Okay, just pull. Good. Okay, so everybody's familiar with the muscle test. You can use any muscle you want, but I would use the rectus femoris simply on the basis that you need two hands free. Okay, and you'll see why in a minute. So the first one is you stick a finger in the umbilicus. Now you ask the patient, is this all right? Because some people are a bit funny about it. Okay, so then you've got a bit of an issue. Now you can use something else in there instead, but you'll see the value is actually of just putting a finger in, pull. Now I'm doing that to make sure she hasn't got something wrong there, because she could have an inflammation. A lot of people get eczema and things in there and so on. Naval fluff does not therapy localize. Okay. So now, in reference to the energy going in, we're going to use the alarm points, just like we use for the then and now technique, if you teach that or are familiar with that. So we're going to go begin at the beginning of the day. So I'm going to go onto the large intestine, or I'm going to put her hand in reference to the umbilicus. So this is our reference beam, this is our object beam. So we're going to say, in reference to the umbilicus, how do you like your large intestine? Pull. Now the large intestine is 5 until 7 at the moment, isn't it? Okay. Then I'm going to go, and you can follow these points if you're not familiar with them on the chart. Put all your fingers on. Just don't let me do it.
Sorry.
Don't keep moving. Okay, just follow where I put them. Okay. So pull. So we're doing stomach, which is 7 till 9, and then you follow around the rib cage until you find the 11th rib. Now sometimes that's about halfway around, sometimes it's here, and sometimes a little further back. Just follow along the rib cage until you find that 11th floating rib there. Pull. That's spleen. Pull. That's 9 until 11 in the morning. Okay. Then we'll go for the heart, which is just below the xiphoid in the midline here. That's 11 o'clock till 1 o'clock. So we're actually in heart time now. So pull. Now, if I take everything off, okay, and just show you that she's in heart time now, just in the clear as such. Yes, that's right, 5 to 12, isn't it? Okay, pull. And the strong muscle goes weak because her body clock is set correct. Okay, so there's nothing wrong with that. Okay, that just means her body clock. But in reference to the umbilicus, how do you like your heart? Meridian. The answer is pull. There's no reaction. Okay, it's fine. Okay, it's no detrimental. So although it's heart time at the moment, it will go weak in the clear, the heart, because we're at heart time. But in reference to the umbilicus, it won't unless there is an issue with it. So if it goes weak, then we know we've got a heart time. Okay. Now we go down to small intestine. So that will be 1 o'clock till 3 o'clock this afternoon. Pull. Then we go to bladder, which is 3 o'clock in the afternoon till 5 o'clock in the afternoon. All right, everybody with me so far? Okay, which is just above the pubic symphysis. And then we go round onto the 12th rib. Let me just find out. 12th rib, tip of the 12th rib at the back, which is kidney time, which is 5 until 7. Pull. Okay. Then comes the circulation sex, which you assure the patient it's nothing to do with sex. But you don't have to say what you're doing, of course, as you're doing it. You just go round. But if it happens to come up and you say, oh, that's the circulation sex. Meridian, pull, and you tell them then, this is nothing to do with sex. Okay, this is to do with the steroid hormones, which are in the ovaries and the adrenal glands. Okay, so pull. So there's our first one. Okay, so we have a drop. We will have 2. I've never yet found more than 2, and I've never found less than 2. But there will be 2 meridians, which we'll show for whatever reason. Okay, after circulation sex comes the triple warmer. Triple warmer is better. Circulation sex is 7 till 9, 9 to 11 in the evening. Pull is triple warmer time. So more or less when you're going to bed. And then we go on the gallbladder. Okay, so remember these are all alarm points, although some of them coincide with the beginning and ending. It is 11 o'clock till 1 o'clock in the morning, 11 o'clock in the evening. Okay, and then we go to liver, which is 1 till 3 in the morning. Pull. And then I'm sweating. I've got 1 to go. Okay. So it has to be the lung meridian is the other one. So there's always 2. Sometimes it's liver and lung, and you go all the way around, and then you hit it. Pull. There she is. Now, which is the important one there? Okay. Now, one of these is more important than the other. Pull. Now, the reason we want to find out which is more the cause and which perhaps is the effect, we may call it more the genotype and the phenotype, but we want to know which is the important one. The important one is the one associated with the emotions, because probably ultimately at the end of the day, all problems emanate from the mind, and they emanate from the unconscious mind, and then they materialize into the conscious and then the physical body and so on. So what we're going to do is we're going to keep her on the lung in this way, and I'm going to get her to look down. So I'm going to take her eyes down as far as they'll go together, down. So she's going down into the unconscious. Pull, and you'll see that makes no difference at all to her. Back up again, and then we go to the circulation sex. Okay, pull, down, look down, pull, and she's strong. So that's the link to the unconscious mind. So we know that there is an unconscious emotion involved here. This is the one to go to. So we will find that whatever nutrients we find, whatever remedies we find, we'll fix both anyway. Okay, so what we're going to do is we're going to go on and work on the circulation sex. So we'll work on that one first of all. Is everybody with me so far what I've done? So in reference to the umbilicus, in other words, your chi, life energy, etc., how do you like, and then going around the alarm points, and we found 2. Then we cross-check one against the other to the emotion, to the unconscious emotion, and one of them will strengthen, the other one won't. Okay? Okay. Now, we'll go a little bit deeper and we'll find the muscle related to this in a minute, because there will be a physical manifestation of the unconscious emotion in the muscle. Okay? So we'll come into that in a minute. But let's see what we're going to do in relationship to the circulation sex. So where have we got on the chart? So we've got challenge, which one negates with the eyes down. This is more the genotype, in other words, getting into the genes, as opposed with, it was associated with the unconscious emotion. The other would be more how the body's expressing itself at the moment. Alarm points, which you're all familiar with. I've updated this one from last time we did it because we were in summertime last week, or 2 weeks ago. So last time we did this, it was in summertime, so we've changed those. Okay. Number 4, identify the weak associated muscle to the genotype meridian and use this in all the testing. You may want to do that at this stage, or you may wait. Let's do it at this stage, shall we? So let's have a look. You keep those there, those there. Now, what I'm going you to do is to press your left leg out to the side. Okay, so we're doing gluteus medius. I'm going to just rotate her leg internally, push out, to do the anterior fibers of gluteus medius, push out, and turn it external rotation to do the posterior fibers. Then we'll do the same thing here, push out with the leg. Okay, turn her, push out. So we've definitely got a weakness of the anterior, push out, push out. We've got a weakness of the anterior fibers of gluteus medius, push out. Posterior is all right. Gluteus circulation sec's got a lot of muscles on it. Okay, sometimes you find several muscles. So what we'll do is we'll push your foot in that way. Good. So we do piriformis. Push your foot in that way. So we've got a real weak piriformis here. Push in. So the least we want to do is strengthen up the piriformis and the gluteus medius. Right? So we could use that now as all the way through, but I find it's a bit fatiguing. So I'm going to use the alarm points again and then come back to the muscle, because if you keep using a weak muscle, it tends to fatigue even more. So we'll come back and we'll use that one here. So what we want to do is plug her in, and you're not to move from that. Okay. So pull your knee up, pull. Okay, now, how do we get into what the possibilities are? There's a sequence. Okay, now, the sequence is to do the eye positions in a particular order. And we'll find out why it's in this order when we get to the end. Okay, there is a reason for this. So the first one is to check the cranium. So breathe in deeply, hold it in, pull, breathe out, right out, right out, right out, hold it out, pull, breathe normally. Okay, so inspiration, expiration checks for the primary respiratory motion, and she's fine. Okay, next one is an infection. So an infection is very important. Follow my finger. Round and round. If you've got an infection, this rules everything with health. Pull. Okay, and then we'll go 2 or 3 times one way, 2 or 3 times the other way. Okay, pull. If you've got a virus, a bacteria, parasite, fungal, overgrowth and so on, this is really important to the upfront part of the body. Okay, so you have to treat that, okay, with whatever remedy you find. Okay, next one is allergy. If you've got an acute allergic reaction, that is supreme, if you like. Not as important as an infection, but nonetheless it's very important. So eyes to the right and down. So we're using the NLP eye positions. Pull. And we're doing the, taking the eyes into that position, out again, in and out, okay, in the allergy. And that's clear with you. And then we go over to the left. So we're going over to the left a few times. Pull. That's for toxicity. So toxicity is clear. Then we do dehydration. Eyes to the right and up. Most of you are familiar with these eye positions. Pull. So we do it 2 or 3 times. It's called habituation. So you do it like a habit. So in other words, the brain picks it up, the position, then you've got about 10 seconds after you've done it to do the muscle test. Okay? Then it reverts back to where it was. Okay? Now that's interesting. I couldn't understand this when I found the sequence, that toxicity shows up before dehydration, because I would have thought dehydration would be more important, because if you haven't got enough water, you're not going to flush your toxins out, right? But there's a reason for this that you'll see in a minute, a very good reason why it's that way around. Okay? Now, to the left and down, structure. Okay? Very important structure, but sort of middle of the road. Pull. Okay? So that we're looking for something that strengthens. Remember, she's in weakness. Okay? Now, eyes to the left and up. Left and up. Left and up. Now we're doing nutrition. Pull. Clear. Okay? 2 to go. Okay? Up, down. Up, down. Up, down. Hypoxia. Okay? Pull. Got her. Okay? So she's short of oxygen. So if Jill just gets out the oxygen, get the mask out now, or the frequency of O2. So we've given her 10 seconds, so she should have gone back in now. Pull, as I say, the habituation will be over. We'll just confirm that. You really don't have to, but it's nice to just do these things to make sure. So pull, so oxygen it is. Now, we've learned that almost anything can cause hypoxia. Could be a fatty acid disorder, because you're not getting the O2 across the lungs. It could be a mechanical problem, but we know there's no mechanics showing up at the moment. But it could be a phospholipid of some form for the membranes in the lung alveolar. It's got across the alveoli, it's got across the capillary wall, it's got across the red blood cell membranes and so on. So what we're going to do is we're going to use our composites. Okay, this is the quick way. We know it's going to be something nutritious. So if we say use an unsaturated fatty acid composite first, so that will give us mostly our phospholipids there. So I don't really bother with an order with these, but we'll do it in a logical sequence and give the unsaturated fatty acids. So if we pop that one there, pull, 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 pull. So she doesn't strengthen to an unsaturated fatty acid. So now we go through the composites. So let's do saturates. So we've got saturates? Yeah. Okay. So there's no particular order of preference. Pull. You just got to go through them all and hope that it comes out. Now the next one is we want amino acids. Now sometimes amino acids show up. Very frequently the ones that show up when we do this, pull, are the branch chain amino acids, BCAA. And when the amino acids show up here, the first ones I go to in my box are leucine, isoleucine and valine. Okay? And if all 3 of those show up, that means you've got a trouble with your branch chain amino acids. And the branch chain amino acids are the ones which are richest in the muscle tissue. And what this means is you're burning muscle. So when you've had your blood sugar level up, you've done a bit of exercise after you've eaten and so on, you burnt your blood sugar up, you then mobilize glycogen from your liver and from your muscles, and when you run out of that, you should burn fat, okay, not protein. If you start to burn protein, you will strip your muscle. Okay? If I break my arm will waste, okay, but I can build it back up afterwards with the right exercise. But if I've lost my muscle, I can't. That's called sarcopenia, and that's what happens when people get older. When they get older and they lose muscle, they can't put it back on because it's gone, okay? So if a person shows strengthening to branch chain amino acid, it means they're stripping their muscle. This is very serious, okay? Because they won't ever put that back on. You find this with middle-aged and older people who run a lot, okay? They do a lot of sport, okay? They think they're doing good. They're getting trimmer and trimmer and trimmer. But what they're getting is thinner and thinner and thinner with their muscle tissue. And they don't realize this. So by giving them the branch chain amino acids, it supports them. So they don't keep stripping the valine and the leucine and isoleucine from the muscle tissue. But what it means is they're not burning fat. Okay? So you've got to open that beta oxidation pathway up. Temporarily, yes, give them the branch chain amino acids to stop them injuring their tissues. But it's very, very important that you try and open that up. So remember, the sequence of producing energy is blood sugar, blood glucose first, liver and muscle glycogen, fat, and then finally protein. Okay? Only when you run out of fat. And most of us don't run out of fat. Okay, so if you had the choice, I'd rather burn fat than protein, wouldn't you? Okay, so if you've got someone who shows to needing the branch chain amino acids, put them on it, but try and open the pathway of beta oxidation up, which will show you what that is in a minute. Okay, where did we get to? Amino acids. Okay, so nothing yet. Right, so now we do vitamins, yeah? Vitamins are water-soluble vitamins. Fat-soluble vitamins don't show in, the composite with the water. Paul? So when we put vitamins in there, that's the B's and the C's and things. Okay. Minerals. So this is all mineral compounds and non-compounds like iodine. Paul? No. Coenzymes. The coenzyme, are you familiar with what a coenzyme is? It's an activated vitamin, usually vitamin B. So pyridoxal 5-phosphate is the coenzyme of pyridoxine, which is vitamin B6. Are you familiar with that? Paul? So if a person strengthens to pyridoxal 5-phosphate, they may not strengthen to pyridoxine. Okay? So this person needs the coenzyme and not the vitamin. Okay? So you come to the conclusion their problem is they're not activating the vitamin to get it to work. All right? So in other words, they're not B6 deficient in their diet, they just can't get it to work properly. Okay? So you have to give them the pre-prepared, if you like, pyridoxal 5-phosphate, the coenzyme, because maybe they've got a polymorphism or a genetic defect which inhibits them from being able to activate it. Maybe a nutrient will help to activate it, like zinc or magnesium and things, but that would have shown up as a mineral. So if she'd strengthened to P5P, pyridoxal 5-phosphate, we may have had to give P5P. But the reality is she didn't. So that's not the issue. Okay. Right. Now what have we got left?
Probiotics.
Probiotics. Very important, aren't they? Probiotics. Amazing. Even with hypoxia or lack of oxygen, how often it's a poison from the gut. A lot of toxins from the wrong bacteria in there, Paul. So probiotics do show up quite a lot, particularly if they've told you they get gas and saccharides. Unusual, although we did come across occasionally mannose, glucosamine. Now, okay, now for the big boys. Yes, okay. Now for the big boys. Okay, this is the difference here. So now we're going to do the fat-soluble vitamins, and we have two of those. We have A, D, well, we have three, A, D, and K. So we're going to do D first. Paul? So she's strengthening to that one. Now give me the A.
Small tool.
Yeah. What we're going to do is the A, so I've cleared the A. Good. Paul? So A is okay, and give me activator X. The X factor it's called. Paul? Now. Okay, the X factor, I'll talk about what that is. Okay, so D shows up. So this is why I asked whether she got the winter blues. Okay? Because D is known to go down the production of D during the winter. Okay? Because we make D, as we'll learn, from ultraviolet in the summer months. In the UK, at our latitude, we have the 21st of September to the 21st of March when we don't have the ultraviolet high enough to stimulate the conversion of cholesterol under the skin into vitamin D. Now, vitamin D from the sunshine there, the conversion, and vitamin D from our diet is called cholecalciferol, otherwise known as D3. Okay? There is a D2, there's a D1, there's a D4, there's a D5, but D2 and D3. Now, D2 commercially is largely synthetic, okay? But they are just producing one now from mushrooms, because mushrooms which are irradiated in ultraviolet are a very good source of vitamin D. But commercially produced mushrooms, of course, are in polytunnels or in the dark, in old railway tunnels, in the dark, and never see the light, so they don't have any vitamin D in them. But the vitamin D commercially, vitamin D3, basically all comes from the same source. Doesn't matter whether you purchase it from our company, any other company, from big pharmaceuticals, it all comes from the same source. And that source is sheep lanolin. Okay? It's in the secretions of the sheep, okay? The oily sebum from the sweat glands or the sweaty glands, the sebaceous glands of the sheep. And the sheep then irradiates in the sunshine. Okay? And then you shear the sheep, and then they take the lanolin off. You remember lanolin? It's that horrible sticky stuff, isn't it? You ever had your chest rubbed with lanolin by your mum when you coughed or something? So it all comes from the same source, okay? It's irradiated lanolin. And lanolin is the finest source of cholesterol. It's cholesterol, Okay? So irradiated cholesterol, in other words, converts to just as it does in the skin in us. Okay? Now, where does that occur mainly is in the bits that the sunshine can get through. Okay? And the most important part with the sheep, like all animals, is the tummy. Okay? Because you notice they don't have much hair on the tummy, so the sunshine goes through. So, okay, those of you who've got a dog know what a dog does. When it's a sunny day, the dog goes out, doesn't it? Goes out, lays down there, turns over, you know, and you think, oh, what's it trying to do? You know, expose all its private parts there. Okay? It's exposing it to the sunshine. And you notice it will lie there exactly for 5 to 10 minutes and then go indoors again, okay, or go somewhere else. You think, oh, lucky devil, just lying in the sun, you know. But they're actually lying in the sun for a reason. They're lying in the sun instinctively because they're building up their D, okay? They don't get it through the fur at the back because the sun doesn't go through. They get it on their tummies, okay? That's why they lie on the side or on the back even. But strictly 10 minutes, and that's really what we should do as well. Ours is a little bit longer. Ours, they say, is 20 minutes or so with a 40% exposure. That means your top off, okay? So when did you last expose yourself with your top off for 20 minutes? August? Maybe. Maybe not even August. I don't know. Maybe you were on holiday. What? It was cold, yes, so you may not have got it very much. September was quite good, but of course, September the sun was going down, so you've only really got maybe half an hour either side of midday. Remember, September is the summer time, so midday is 1 o'clock in the afternoon, isn't it? Because we set forward. So never forget that. So it's no good stripping off at 12 o'clock because that's actually 11 o'clock. Or double Dutch. No. Okay, so you need to have a 40% exposure, which means basically taking your top off. Being exposed on your hands and face is not enough. Shorts will give you some. Okay, this is why now they're advocating boys go back into wearing shorts again. When I was at school, we were 14 before we were allowed to wear long trousers at school. And it was a damn good job because we got sunshine on our legs, okay? Now they're worried that there's a recurrence back of rickets, which is a real low deficiency of vitamin D in children because they all wear long trousers, girls and boys. Okay? And when I tackle this with patients, I find that some of them don't ever go out. Even in the summer, oh, it's too hot. Or, when did you last take your top off? I never take my top off. And older people don't tend to take their tops off and things or expose themselves. And really, where do you get your D from? You know, the D otherwise is in a little bit in butter, little bit, but that evil stuff we were told not to eat. But now they said, oh yes, it's not so bad. Mushrooms grown in the sunshine. Well, how often do you get a wild mushroom? And cod liver oil. How many people eat cod liver oil anymore? Not very many people. Halibut doesn't seem to have the D in. It has the A but not the D. So the A and the D is very good in cod liver oil. Or other livers. Great food. People don't eat liver anymore because it's all full of toxins. It's where you store the dioxins and the PCBs and things. So if you do have liver, and it's a very good thing, is you must have organic. Okay? Make sure it's organic, and then it's a good source of A and D. But that's cholecalciferol, D3. So let's test her with cholecalciferol, D3. Okay? Because this may be quite surprising to you what's about to occur. So this is D3, cholecalciferol. If you follow the chart now in the laminate there, you will see exactly where we are. Okay, so follow the laminate with the picture of the vitamin D. It says vitamin D, so you can't miss it. Okay, pull. Now, isn't that interesting? Vitamin D, cholecalciferol, pull. She doesn't strengthen to it. So what did I say about pyridoxal 5-phosphate and pyridoxine? If a person strengthens to pyridoxal 5-phosphate but doesn't to pyridoxine, they're not B6 deficient. They can't convert. She's not deficient in D. Right, give me the next form. She has to get the D from the skin or from her diet into her liver. And the first process here she's going to do is to hydroxylate. So she's going to hydroxylate at the 25 position of the vitamin D, cholecalciferol. So this is called 25-OH, or hydroxyl cholecalciferol. Can you see it with the picture of the liver there? All right, see it in the picture. Okay. Now, so this is the first bit. Now, I'm going to pop that on her. Pull. No. She doesn't strengthen to it. Okay. So in other words, she's got enough in there. Now, later on when we talk about D, I want you to think of the hydroxylated form as the storage form. Okay, this is not the biologically active form of D. This is what they measure in the blood, because you can't measure the activated forms because they have such a short half-life. Okay? So they measure the blood level of 25 hydroxy cholecalciferol. Okay? This is the storage form. But you store this in your liver, you store it in your muscles, and you store it in your fat. Okay? For the winter. Okay? What is in the blood is extra. So taking a blood test is not necessarily a very good examination of 25 hydroxy cholecalciferol. It may be within the normal parameters, and often people come back and say, well, my vitamin D level was normal, but it doesn't tell you what they're going to be like in the middle of the winter. They've got how much is in their fat, how much is in their muscles, and how much is in their liver. There's no way of knowing that, except by a functional test like we're doing. Okay? Now, let's do the 125. This is the activated form that occurs in the liver, in the kidney. So we've stored it in, we converted it in the liver. We then pump it round to the kidney. Okay, so the 125, this one is involved mainly with regulating calcium. Okay, so the 125. This is the one that the books, the biochemistry books, Harper's biochemistry books, all tell you is the biologically active form of it. Pull. No. Okay, and that mystified me completely because I hardly ever found somebody needed the 125. Sam, when did you last find somebody with 125 in the old Master Nutrition book? When did we prescribe vitamin D before we knew this? Years ago. Okay. Now, there's another biologically active form, the 2425. Okay? And this they found is activated in all sorts of tissues in the body, including the breasts, the uterus, the prostate gland, the lungs, the brain. Every organ in the body has receptors for vitamin D receptors, but it's the activated Ds that they have the receptors for. So the kidney is more the 125, which is related to the bone calciums, to allow calcium in and out and that sort of regulation. Right? The 2425 is the one involved with the immune system and all the organs in the body. So that's the 2425. Okay? Paul? Okay? That's what she's deficient in. Okay? She's deficient in 2425. In fact, if we put the 125 on her, and this is real cutting edge because you'll see this in Medline now, there's new reports on this, that the 125 and the 2425 work as opposites. One increases calcium and one decreases it. Paul, she actually weakens to the activated form of vitamin D, 125. That's horrific. That means she's got too high a calcium. Okay, she's got too much calcium. She's weakening to this. Her body's saying, don't make any more 125. You know, I've got too much of this. She's going to weaken to calcium. Have you got a source of calcium there? If you go to one of those kits there, if you give me calcium, yes, calcium, you've got a lactate there. That's a nice soluble form. Or chloride will do. Give me a calcium chloride. This is a calcium chloride. So in the clear, I'm just testing her with calcium. Pull. She's got high calcium. Pull. Pull. Okay, you can imagine she's got relatively high calcium. What's she going to do with it? Pop it in her arteries? Pop it in the kidney, hopefully will pass it out. Okay? So she's got a real issue here because she's got circulation sex, which is the adrenal glands, isn't it, that she's relating to here. And she needs to get rid of the calcium because it's going to build up. Do you have any joint aches and pains?
Yeah.
Yeah, where?
The knees, elbows.
Knees, elbows, she's got joint pain.
In my hips.
And the hips, okay? Why has she got it in the hips? Because her muscles are weak. She's got no power in the piriformis and in the glutes, okay? You'll see now how it all fits in. Shoulders, did you say shoulders?
Yes.
Yes, why is the shoulders? Lung meridian, that was her other meridian, wasn't it? This is where all her weaknesses are. She's already telling you this, isn't that beautiful? Her body's saying, that's when my energy levels are down. I'm not producing the background nuclear explosions as I should at these times. Okay? Now, this one is more important than this one in her case, the circulation sex. So when we get the remedy, it'll build the muscle up, won't it? Okay? So let's go back now and put the 2425 on her. Okay, I'm sorry, going to be in your view a little bit here. Push your foot in. This was the piriformis. Okay, so she's strong there. And this one was let me turn it, push out, was the anterior part. Okay, now if we take that off, push out. So that confirms, push the foot in that way. Okay, she has no power at all, but with the 24, 25 she does. So where's her problem? Her problem is she's not able to convert the 25 hydroxy to the 24, 25. Okay, and where does that occur? In all sorts of tissues. Okay, not just the bone or the kidney, as the books tell you, but this occurs if you follow your chart here, it'll tell you, or should tell you there. So in the immune cells, okay, it occurs in the immune cells, the macrophages and the monocytes, in the bone, in the intestine, in the brain, all sorts of places where vitamin D receptors are. In the breast, in the lungs, in the gut. They've all got vitamin D receptors. In her case, the adrenal glands. In the ovaries, in the boys, it's in the prostate gland. Okay? But you'll find it will be the 24, 25. Some people, it's the 125 they need. Okay? And then they weaken to the 24, 25. Now, this conversion is a cytochrome P450 enzyme. It's an oxidizing enzyme. It puts the OH on. Why do we put an OH on? Anybody remember whenever we detoxify and we use cytochrome P450 enzymes? It's to make it more water-soluble, because vitamin D is not water-soluble. It's a fat-soluble vitamin. So it has to be taken with an oil. So we've got to stimulate cytochrome P450 family in where we're going to stimulate? In the liver and the other organs in the body. Okay? Now we need to find something that will stimulate cytochrome P450, okay, pathway, to activate the 25 to the 24. What's your Christian name, first name?
Sorry.
What's your first name?
Susie.
Susie. So in Susie's case, there's a defect in that particular enzyme, right? So we have to find out what it is. So now let's give me the other product, the one that you did before, which we call the SMART vitamin D. This is cholecalciferol, just the basic stuff that doesn't work. Stick that one on there. Let's try this one and push your leg out to the side, and you see she's rock solid with it. And push your foot in that way. Push the foot in that way. Yeah. No, not the leg, the foot.
The foot.
Let me show you that.
Yeah.
Okay, push.
Brain's connecting.
Okay. Your brain will connect much more when you've got your D. Okay. Right, now we need a glass and we need some D. Okay, now this is called Smart D, and there's one simple substance. And what a lot of authorities say is to get D to get absorbed and to get it to work, like so many other things, you need a substance which will piggyback it. And what they recommend is piperine. Anybody heard of piperine? It's an extract from black pepper, and it doesn't work. So when you add piperine to vitamin D, it doesn't strengthen. But there's another substance which contains an element which is peppery. It's like piperine. I don't know what it is. And that's black cumin seed. Now, black cumin seed, if you chew black cumin seeds, you know what it's like to have a peppery taste. If you tried the oil, it's beautifully peppered. So what we do is we're going to now do the vitamin D in black cumin seed. Previously, we've used hemp seed because hemp is a natural source of vitamin D, but it's cholecalciferol. It's just plain vitamin D. It doesn't activate it. Okay? This activates it, and you'll see it has a wonderful effect, because this is the D that she needs. So in other words, if she said, well, actually, I'm taking D already. 2 weeks ago, we did this same seminar in Bristol. And at the end of the session, this guy said, what do you suggest for me? He said, because I have prostate problems. And I said, vitamin D, because you need the activated forms of the vitamin D. And he said, I already take vitamin D. So I said, oh yeah, what do you take? And he told me the name of the company that he took it from. He didn't understand, and the whole day I talked about vitamin D, but he didn't understand that it's no good taking vitamin D. He didn't strengthen the vitamin D. He's quite right, he doesn't need it. He needs the activated form. Okay, it's like giving somebody pyridoxine who's deficient in pyridoxal 5-phosphate. It doesn't work. Okay, you have to. The only one that works is the one that strengthens the muscle. Okay, that's your bottom line. Okay, use that as the final bit, and we'll see why as we go along. So what we're going to do now is we're going to use the muscle to do the final dose. Hold tight there. Hold tight. That's it. So what we're going to do is we're going to put one finger... No, we'll use the muscle. That's the easiest way. Okay, take that one away. Okay, now, people need hundreds of drops. We made a vitamin D of 100 international units per drop. And many people need 100, even 200. And we'll talk about the doses and things as we go along. So that was ridiculous. Okay? So what we've done is we've made a vitamin D 10 times the strength. Okay? So this is a whopping 1,000 international units, or 50 micrograms per drop. Okay? Per drop. Now, that sounds enormous, doesn't it? 1,000 per drop. Now, you and I, in midsummer, take the top off, you will make 20,000. Okay? Or, it doesn't have to be midsummer, you just go across to Antigua in the middle of winter, in January, have a week there, and you'll top up beautifully with vitamin D. But it will be useless if you can't work with it, can't use it. And this is what I had. All summer I couldn't understand this. People were coming in vitamin D deficient. And yet they've been in the sunshine. They said, well, I've just come back from holiday. And of course they weren't D deficient, they were hydroxy 25, 125, 24, 25. They weren't converting it. Now, you'll find that maybe 25% of the people, when you do this, go round the clock, will show the liver as one of the major meridians. When that shows, these people need the 25. They're not converting to the first part. People who have liver dysfunction won't even get as far as storing it, converting it. Okay, so they pile in more D. And of course, more has to be just peed out because they can't do anything with it. Okay? And they take this. This is the fallacy of these people with osteoporosis and things. And they get prescribed D. And they get D, it goes in here, if it goes in, because it's not often in water. If it's in water, you might as well throw it straight over your shoulder, if it's a capsule or tablet. What you have to have it is with either in oil, in a spoonful of oil, or already made in oil, which is great. But even with that, it will go straight through, okay, if you don't convert it in the liver. Once you convert it in the liver, then you can store it, and then the body can use it. And it has a half-life of about 15 hours. So it's very quick. This is why they don't measure the activated forms, because it's going down. The activated form is called upon from the storage as it's required. Okay? So it has to mobilize it, has to hydroxylate it for the second time to the 125 or the 2425 as required by the body. So it takes the storage. So you can imagine for most of these people by January, they're really low, aren't they? You know, most of us are low. It's usually 2 days after Christmas, or maybe 2 days before Christmas. And then they go down. Choom, 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 don't they? And that's when the flu epidemic comes in, the coughs, the colds, all that sort of thing hit, okay? When the D level is lowest. And it's exactly 3 months after the 21st of September, when you get to the 21st of December, that you've run out. Your storage is gone. Okay, most people store for anything up to, maybe up to 3 months. Some it's much less than that. Especially if they haven't converted, they're not going to store, you know, anywhere near the amount. Now, on the surface of the macrophages and the monocytes are vitamin D receptors, and these are two of the most important differentiating white cells for tackling infections. Okay? So if you've got no D, you can't activate, you can't differentiate. So you get white cells produced in your blood bone marrow, but they don't know what to do. They haven't been given orders. You're a macrophage, you're a monocyte. Okay? So they're soldiers without weapons. Okay? That's when you're an open book. This is the connection of the D to the immune. Now, one of the things, and you'll see, one of the many enzymes that it induces, in other words, it upregulates, is the conversion of cholesterol to progesterone, which is why it's important for the steroid hormones in there, and the conversion of tryptophan to 5-hydroxytryptophan to go on to make serotonin. And that's why I asked about the winter blues. So this is why people get the winter blues, is they're actually low in serotonin. That's the true blues. And they're getting that because they haven't got the D to stimulate the hydroxyl enzyme to make the 5-hydroxytryptophan and then to make it into serotonin. Okay? So that's two of the enzymes. So these people, if you are low in D, and that's the activated D, of course, to get it to work, you will not produce progesterone in the adrenals or the ovaries, and you won't produce enough serotonin. So that gives you the winter blues. Okay? So you not only have you got hormone problems, but you've got the blues to go with it. begin to recognise any of your patients?
Yeah.
Yes, okay. Would you never find that vitamin D shows for them? No, you don't find that it shows. In a lot of people, it doesn't show because you're not testing with the right substance. It's nice testing for B6 with only having pyridoxine and not pyridoxal 5-phosphate at your command.